HER2 is not only a biomarker for an aggressive type of breast cancer, but it's also a protein that can cause breast cancer cells to grow. We asked Dr. Ian Kropp, an expert in HER2-positive breast cancer and Komen Scholar alumni, exactly how HER2 works to drive breast cancer.
HER2 is a protein that's on the surface of all cells. It's a normal protein. And what HER2 does is when a cell is under stress, it activates the cell to grow more quickly and kind of be stronger. And what happens in about 15 or 20% of breast cancers is that while that cancer is developing, it has a mutation or an alteration in one of the genes, the DNA of the cell, that leads to dramatic overexpression of this HER2 protein. So a normal cell might have 1,000 HER2 proteins on the surface, and a HER2 positive cell will have 1,000,000 of these HER2 proteins. So these cells are really just covered in this HER2 protein. And as I mentioned, the function of HER2 is to tell the cell to grow more quickly and to be stronger. And so when you have 1,000,000 of these proteins all telling the cell to grow more quickly, the cell grows more quickly. So without treatment, a HER2 positive breast cancer tends to be a little bit more aggressive than a cancer that's not HER2 positive. But around in the late 1990s, it was realized that the reason these cancers behave more aggressively is because of this HER2 protein, and that led to the development of drugs that block that HER2 protein.
The first HER2 targeting treatment is called trastuzumab, or Herceptin, and this was approved in 1998. Since then, there has been a stunning amount of progress in HER2 targeting treatments. Researchers have built on this momentum, and we now have a total of 8 drugs that all target HER2. Countless clinical trials have been conducted that have helped us to move the needle to understand when to give each of these different drugs to the right person at the right time. With all of this progress, you might be wondering, why is HER2 positive breast cancer still a problem? We asked Dr. Kropp what the biggest issues are that researchers and doctors are trying to solve for HER2 positive breast cancer.
There still is a couple things that we really would like to improve upon. And so one is that while we have 8 different HER2 directed drugs, all of which have effectiveness, there are some patients who eventually their cancer becomes resistant to all of those different treatments. So there's always room for drugs that can reverse this thing called therapy resistance. So cancers evolve, they can change and evolve over time to become resistant to our drugs, just like bacteria can become resistant to antibiotics. And so we switch from one drug to another. But what we really hate to happen is when we kind of run out of effective therapies for a specific patient. So one challenge that we need to work on is coming up with drugs that overcome this resistance in patients. And that's something that we're always working on, and there's a lot of work being done in that area. So that's one thing. And the other one that's really that can be a challenge is when HER2 positive breast cancer travels to the brain. And it does this not uncommonly for reasons that we don't completely understand, but we do know that patients with HER2 positive advanced breast cancer can develop metastases to the brain. And we have effective therapies. Radiation can work very well in that situation. But in some patients, even after radiation, the cancer can come back in the brain. And we have some drugs that work in that area. Tucatinib is one. It does appear that some of these antibody drug conjugates, like trastuzumab deruxtecan or Enhertu, also can work in the brain. But there clearly is a opportunity to get even better therapies for brain metastases, and a lot of work is being done in that area.
If you're interested in learning more about how HER2 targeting therapies work, check out the link for this video. Dr. Kropp also spoke with us about the latest research in advanced HER2 positive breast cancer that he thinks is really exciting right now.
Again, it's an exciting field. There's a lot of things going on. Of course, we would not have made any progress without patients participating in clinical trials. And there are a number of trials going on now that people are excited about the results as they start to come out. There's a trial called CAPE3, which is combining TDM1 or Kadcyla, the antibody-drug conjugate, with a drug that activates the immune system. This is a drug called atezolizumab, which is a mouthful, but it's a drug that is designed to kind of reactivate and wake up a person's immune system so that immune system can go help fight the cancer in addition to the TDM1. That's a trial that I think we're excited about because these immune therapies have been very effective in other kinds of breast cancer, not yet shown to be effective in HER2-positive breast cancer. But so this will be a trial that's asking that question. There's other combinations combining tucatinib, which is a oral inhibitor of HER2. It's already used in combination with trastuzumab and capecitabine in patients who've had a number of lines of therapy. But the idea with tucatinib is now being tested is whether you combine it with other drugs like TDM1 or like pertuzumab and trastuzumab as a way to make the effectiveness of tucatinib even stronger. So there's two different trials, HER2CLIMB-02, which is combining tucatinib with TDM1, and HER2CLIMB-05, which is combining tucatinib with pertuzumab and trastuzumab in that first-line THP regimen after patients have finished the chemotherapy part. Both of those have very good laboratory data to say that those combinations should be effective. So I think everybody's optimistic and hopeful that the trials are going to show that tucatinib is beneficial in those settings. And then lastly was trying to improve that first-line THP regimen to find something better. So as I said, HER2CLIMB-05 is asking whether adding tucatinib will improve the effectiveness. DESTINY-Breast09 is a trial that's substituting the taxane and Herceptin Perjeta regimen for a different regimen using that TDXD or trastuzumab deruxtecan or HER2 antibody-drug conjugate. HER2 has shown really remarkable effectiveness in patients who've already had at least one HER2 therapy. So I think looking at it in the first line, so meaning that for newly diagnosed patients is a area that I think people are also optimistic will show even more efficacy. So again, even though THP is very effective and works well for a long time in most patients, there's still room for improvement, and perhaps using HER2 in that setting will show that kind of even higher level of effectiveness and duration of treatment that we all are looking for, so that patients don't have to change therapies very often.